Hello everyone. Today I wanted to address the first time parents. It's the most anxious moments. We complete our 9 months of antenatal period, waiting for our little bundle of joy to come in. Then we go to the labor room, we have the delivery done, and then it's time to go home. Wow, and then what? So, first time parents can really get intimidated at the thought of taking care of their newborn alone in their home. So, there is nothing to panic. There are few things which every newborn goes through in the first few months of life. So, let me unclutter them for you so it becomes a sort of knowing journey and knowing what is going to come across. As soon as we finish the delivery, most times the doctor or the nurse puts the baby on the top of the mother's chest without any clothes on the mother or on the baby. So this is called as skin to skin contact. Skin to skin contact is a very effective tool in providing warmth to the baby. The baby also becomes calmer, stops crying, as the baby can hear the heartbeat of the mother, and mother also feels good about it and starts to develop bonding. So this skin to skin contact is a very effective tool to create bonding, and the first time mothers or the mothers should do it as often when they go home as well. Second point which worry parents is how to breastfeed. So yes, there is a new experience for the mother. Sometimes in the initial days, the mother is not getting sufficient amount of milk, so the babies are continuously suckling. It seems as if the baby is not letting go of the breast at all. This will happen, but gradually as the mother's breast milk improves, her ability to hold the baby, put onto the breast, and her feeding techniques improve, she will see that baby is much more calmer, able to finish the feed within a short period of time, and then goes off to sleep. So, although initially it looks a bit tough, as time passes by, breastfeeding will become easier and mothers will start to enjoy it. We should try and breastfeed first 6 months exclusively. Okay? No water, no other food, no formula feed is required. Only breast milk is sufficient for your baby. About sleep. Generally, initially the babies feed, sleep, feed, sleep, feed, sleep. They would feed every 1 to 2 hours once. The feeding could be 10 to 30 minutes, and then they go off to a sleep for ranging from 1 to 2 hours. So if you were to count in a 24-hour period, babies would be sleeping almost 15 to 17 hours a day, and the rest of the time they would be feeding on the mother. This can really put pressure on the new mothers, especially because babies tend to sleep more in the daytime and be more awake during night times. So what mothers should do? Mothers should try and get as much rest as possible when their baby is resting. If they have some help at home, and if they are able to manage the baby for a couple of hours, the mother should try and get a bit of sleep, because in the night mothers are generally alone and many times they feel helpless as the babies are constantly demanding feeds. Other thing is about crying. So most often, which is 70 to 80% of the times, babies cry when they are hungry. So as soon as babies cry, first thing mother should see is the baby hungry and should offer the breast for feeding. Sometimes it need not be hunger. It could be, for example, the child might have passed urine or might have passed motions, and that wetness may be causing uncomfortability in the child, which can lead to crying. At that time, mothers should see the nappy and diligently change them. Sometimes babies could be too hot in a room you have overwrapped, or babies could feel too cold in the room. Mothers always worry, what is the right temperature for the baby? Well, it's very difficult to put a right number, although a ideal room temperature for the babies would be 25 to 27 degrees centigrade. The best way to see this is whenever mother is inside the room, she should be comfortable. Depending on the number of layers of clothes she is wearing, she has to add one extra to her child to ensure that the child is comfortable as well. So there is no point overwrapping the baby, as this will make them uncomfortable and cry. Sometimes babies do get stomach cramps, as commonly it is called as colic. So they can continuously cry for hours together, pulling up their legs to their abdomen, and the cry will be inconsolable. Sometimes this sheer crying make many mothers feel helpless, and some of them even feel depressed looking at the crying state of their child. So we know that this colic is quite common in newborn babies. Colic does happen usually in the evening times, around 5 to 7 or 5 to 8 p.m. in the evenings. We see that by gentle rocking, the babies can settle down. Sometimes a warm bath will make the children settle down. Other times, a car drive or a small vibratory noise like a table fan making a bit of noise also can put them to sleep. But if the baby is not at all settling, you might be required to visit your pediatrician to see if there is anything else he could do for the baby. Jaundice. All newborn babies do get some jaundice. Some of them could be very mild and go away. Some jaundice could be a slightly high, which might require phototherapy, which happens about 5 to 10% of the babies. Again, the peak jaundice in babies comes around 5th to 7th day. So normally once the baby is discharged home, the pediatrician will call the mother back for a visit to examine the child, and if they see some jaundice, they might order for a blood test. But majority children, jaundice spontaneously resolves by 2 weeks of age. The things which a mother could do to reduce jaundice are good breastfeeding, and the mother could also take the child to sunlight every day for half an hour. In the early mornings could be around 8:39 in the mornings, or evenings it could be around 4 p.m. in the evening. Mothers could take the child dressed in the nappy but no other clothes, can keep the front part of the body for 10-15 minutes and then change, swap the baby for another 10-15 minutes so that the sunlight falls on the back. Bath. At the birth, we do not give a bath to the baby, as baby is covered with the vernix caseosa and it is for 24 to 48 hours. Once the baby gets discharged and goes home, we can give a bath daily in the house. We can keep a small bathtub on the dining table or something so that the mother doesn't hurt her back. There are special baby products which are basically having lesser chemical ingredients. So baby baths or baby soap, baby shampoos are advisable, as the chemicals are much lesser. You can give the baby a bath every day. After bath, it is best to avoid talcum powder, as talcum powder causes dryness of the skin. It is better to use a moisturizing cream all over the body. The umbilical cord. Usually the umbilical cord is the connection between the mother's placenta and the baby. By 10 to 20 days, the umbilical cord will fall on its own. So all we need to do is, after bath, we should wipe it using an alcohol swab and ensure that it is kept clean. When we are putting the nappies, we should ensure that the umbilical cord is not gone in the nappy. It should be kept outside. Otherwise, the urine from the babies can contaminate the umbilical cord, leading to infections. and stools. Initial period, babies pass about 5 or 6 urines per day. Regarding motions, a good fed child can pass motion after every breastfeed. There is nothing to be alarmed about this as it is quite common. Since children are only on breast milk, the stools will be watery as well. In the first few days, the stools will be blackish, which slowly turn into greenish color, and by day 5 or day 6, they become yellow in color and they do stay that way. There are also periods where a completely breastfed child may not have a motion for a few days. That also is in the normal range, okay, and there is nothing to be concerned as long as the baby is feeding well, passing urine, and gaining weight. A brief about vaccines. So, once the baby is born, any hospital will give 3 vaccines, which is the BCG, the polio drops, and the hepatitis B vaccine before the child is discharged. They also get a shot of vitamin K, which is a vitamin at the time of birth. The next vaccines are around 6 weeks of age, and each child will get a chart in which all the vaccines will be clearly mentioned, which will be given by the pediatrician. Okay. So these are the few things which I would try to put across as far as the first time mothers are concerned. But if there are any other queries, please reach out to me and I'll try to answer.